Hello everyone, my name is Anika Gianforte and I'm a dairy processing specialist with Cornell University, and I am bringing the coronavirus booster update to you for the week of January 18th, 2021. This program is brought to you by the Cornell Institute for Food Safety and USDA's NIFA. We're going to start off by looking at some nationwide metrics. So this is from the COVID tracking project. You'll see here on the left that daily tests are at an all-time high. We also see that the case and hospitalizations number are at very high absolute levels. There has been some leveling off over the past few days, but that doesn't mean that these numbers are at really, really high levels in general. So if we were to have seen these numbers a couple months ago, they would be very, very startling to us. So even though there is a slight leveling off, which is a good thing, we should still make sure that folks understand that this is not necessarily a reason to celebrate quite yet because those numbers are so high. So continue to use face masks, social distancing, and hand washing practices to mitigate the spread of that virus. When we look at our New York State trends, they follow a similar pattern. So again, they are high absolute percentages as far as our positive 7-day average and our positive numbers as of yesterday. However, they are slightly down. So again, no reason to relax those mitigation practices just yet because overall these are high percentages. Now, moving into vaccinations a little bit, there's a lot of focus on the challenges with the vaccine distribution. So there's no way around the fact that that has been a really challenging situation. So in New York State, one of the ways that you can check your eligibility or maybe the eligibility of your parent or loved one is to check the Am I Eligible New York State app through the New York State Department of Health. And that will tell you if you're eligible for the vaccine based on your age or occupation. And it will also point you to vaccine distribution locations. So New York State, we know, is only receiving around 250 to 300,000 vaccines per week. And we have millions of people to vaccinate. We're now in phase 1B. We also may have people eligible who are still in 1A. So we have quite a lot of people to vaccinate and not a ton of vaccines coming in on a weekly basis right now. So we do have, I know that people are checking that app frequently to see if their vaccination site has vaccinations available so that they can schedule an appointment. So in New York State, you do have to schedule an appointment in order to get that. So we will update our Institute for Food Safety website when we know when more phases are released or if there's an expansion of the people eligible in phase 1B so far, but we know it's challenging. Just keep checking that website. Local pharmacies who are going to be vaccine distribution centers are also posting on their own websites whether or not they have appointments available. So just keep checking and hopefully we'll have vaccines sooner rather than later, but we are anticipating this rollout to take some time, so be prepared for that. There has also been a lot of talk about fear over the vaccine and what is in the vaccine. So one of the concerns that I've been hearing is that the vaccine is going to incorporate into my DNA, it's going to change my DNA, and it's going to cause XYZ health effect, whether that be infertility or you to have other diseases, so on and so forth. The COVID vaccine is an mRNA vaccine. And mRNA from the vaccine does not edit or incorporate into our human DNA. So that mRNA is relatively very unstable compared to our DNA, and it's just providing the script to be able to help us fight the real COVID-19 vaccine if we were to be exposed to it. So it will not incorporate into your DNA and change your DNA. As far as side effects of the vaccine go, there have been rare reports of anaphylaxis reactions after vaccinations, but no serious health issues with side effects from the vaccine have been reported to date. So the CDC recommends that all vaccine recipients should talk with their healthcare provider if they have a history of severe allergic reaction, like anaphylaxis, to any other vaccine or injectable therapy, whether that be intramuscular, intravenous, or subcutaneous. So that's a specific case that you should, if you are an individual who does have allergic reactions to things like that, definitely talk with your doctor. On the whole, as far as side effects go, there are some slight side effects that you could get from getting the vaccine that are totally normal immune responses. So those include some pain or swelling at the injection site where you would be getting the vaccine. And then throughout the rest of your body, you may experience short-lived fever, chills, tiredness, or headache. Those only last about 24 hours, and they are part of your body's reaction to preparing those antibodies so that if you are exposed to the virus, your antibodies will be prepared to fight those antigens associated with the virus. So that's a normal immune response, only lasts 24 hours. If you have these symptoms, then drink plenty of water, get some rest, and you should be good to go very quickly. We've also been receiving many specific questions from people. So people are saying, should I get the vaccine if I am taking a biologic medication, or should I get the vaccine if I am pregnant? And people with underlying medical conditions can receive the FDA authorized vaccine, provided they have not had a severe allergic reaction to a COVID-19 vaccine or any of the ingredients of the vaccine. So if you are concerned, when in doubt, definitely talk with your doctor. That can't hurt by any means. But we do know that vaccination is an important consideration with adults of any age with underlying medical conditions, because if you do have an underlying medical condition, you could be at an increased risk for severe illness from the virus that causes COVID-19. So it's definitely a question of risk as far as that vaccine can really help you if you were to get COVID, because you would be at an increased risk for being on a respirator or having a much more serious reaction to having the actual virus. As far as food industry take-home messages go, things you could be communicating with your food industry team or your team of employees, make sure that if an individual gets the vaccination, they understand that that doesn't mean that there's an immediate end to all mitigation practices. So the vaccination would be meant to protect them as an individual. We have not yet reached the level of herd immunity that we need to say, okay, we're good to go. We no longer need to do social distancing. We no longer need to wear face coverings. So we're not at that point yet. So make sure your employees understand that getting the vaccination is great, but we still need to be following those mitigation practices, because we don't want transmission of the virus to still occur to those who have not been vaccinated yet. Also help employees get accurate information about the vaccine and their eligibility. So that's going to vary a little bit state by state, but make sure that you're pointing them to scientifically accurate resources, because the internet can be a scary place to get information. So again, help them navigate through that situation. Especially with some of those eligibility questions, the CDC has a lot of information on, if you're pregnant or breastfeeding, if you have a certain underlying medical condition. So point them to those resources to give them the facts. And then lastly, we know that the COVID-19 metrics are remaining high. So make sure that you're reinforcing the basics inside of work and outside of work. So we're at the stage in the pandemic where, people have long been suffering from pandemic fatigue at this point. So it's important that they understand that in the facility, whether it be first, second, third shift around the clock, make sure that they're wearing those face coverings, even if they have a group that they're working with consistently and there's only 4 people in the room on third shift doing sanitation. Make sure that that's happening and having a good COVID-19 culture in your facility. And there's only so much we can do with enforcing how people behave outside of work, but the most we can do is provide them with accurate information about COVID-19 and how it spreads. So make sure that we're being vigilant there and remembering our basics. So we know that social distancing works. We know that face coverings work, and we know that frequent hand washing helps mitigate the spread of COVID-19. So let's keep practicing those. And I'd like to thank the USDA National Institute of Food and Agriculture for providing us with the opportunity to host these weekly COVID-19 boosters. Have a great week.